Hello, everyone, and welcome back to the Waste World podcast. I'm your host, Gage Edwards, and today we're diving into a critical but often overlooked corner of the waste and recycling industry: medical waste management and regulatory compliance. With the healthcare landscape shifting from hospitals to more home-based care, the way we've handled medical waste is rapidly evolving. And add that to the patchwork of state regulations, increasing sustainability expectations, and the need to keep patients and communities safe, it's a complex challenge. Luckily, my guest today has plenty of experience in this space and will be able to describe and discuss everything about it so we have a better understanding of what we need in the space and how things are going. So, I hope you enjoy this episode. My guest today has been with Stericycle since 2009, starting as a healthcare compliance specialist and working her way up to her current role as a senior director of regulatory affairs. She supports both the medical waste and shredding businesses, ensuring services meet the complex regulatory standards that govern healthcare and environmental safety. She has represented Stericycle across multiple industry associations, including the Healthcare Waste Institute, and where she served as a chairperson and continues to serve as a regulatory liaison. She is also a certified hazardous materials manager with a biology degree from Purdue University. Cara Simaga, welcome to the show. How are you? Thanks for being here.
Great. Thanks. I'm doing great. This is the second time I've ever been on a podcast. So I'm learning here. So
nice.
I think we'll be okay.
I would hate to count how many podcasts I've done and how much of my life has lived on the internet. That just seems like a nightmare to me.
It's a different time. I mean, it's a different time.
I wish I could go back to my second podcast ever and be like, look, there I was. No idea what it was, but it was years and years and years ago. Okay.
Yeah.
So Cara, welcome to the show. For people at home who aren't familiar with you and what you do, kind of let's give us the rundown. What is your story and what brings you here today, and who are you?
Okay.
I know it's a big open question, but
yeah. Well, I mean, my story, I always like to, I think, speaking of a different time, how I got into this field in the first place right out of college was through a newspaper ad. So back in the day when you scoured the paper for a job, right? And so there was a job listing for field chemists. I was like, ooh, that sounds cool. And I'm reading the description and it was pretty vague, but it described like environmental work, right? I'm like, yes, that's what I want to do. I'm going to save the world, right? I'm going to get into the environmental field and this is what I'm going to do. Well, come to find out, and I did get the job. It was at a company that now they've changed names, and I don't know if I'm supposed to say names here or not, but it was at a company that disposes of hazardous waste. And the job was traveling the country, via truck. I had to get a CDL and learn how to drive a stick shift box truck. And I drove all over the country packaging hazardous waste, doing something called lab packing. But I did that for a couple of years. It was the strangest job, but yet the most interesting job I've probably had. And it's how I've really kind of learned to appreciate and respect this industry, because there are so many people behind us that work so very hard. I mean, it was physically demanding and just, really rough, wearing all that PPE sometimes, right? So I started there, stayed in hazardous waste for a little while, and then worked at a lab for about a year. Then I managed their hazardous waste, and then came to Stericycle because I wanted to help healthcare with their waste management issues. One of the first customers I went to, I was like, "Hey, where do you store your hazardous waste?" And they take me to their storage room where the red bags are. I was like, "Ooh, you're close, but not quite." Medical waste is the red bag stuff. I'm talking about like chemicals from your lab, or and they're like, "Oh." I'm not really sure, so healthcare kind of had some catching up to do years ago on hazardous waste management. But even with medical waste management, there's a lot to discuss there. So, and then I eventually just kind of worked my way up through the company. Like you said, I've been here since 2009 and found interest in regulatory work. Because for me, I love that collaboration with the regulator, with the regulated community, with us, and that happens quite a bit because we work together to try to figure out how we can write rules to solve some of these problems. So that's a lot, hopefully not too much, but it's an interesting path, I would say.
Yeah, that's chapter 1 on the story here, and that kind of gets us to where we're going. So cool. So now we're at Stericycle. So now you're day to day as the senior director of regulatory affairs. What does that look like for you?
Well, it's definitely not reading regulations all day. Good Lord, that would be so boring, right? It's actually the day to day is answering questions and interpreting those regulations for my team members in sales, in marketing, in operations, sometimes government affairs, because we work with policymakers, customers, of course. I may have said that already, but also, you know, just working with them to kind of understand the why behind why we have this program and why we give you this container and not that one and what
Mhm.
goes in this container instead of that one. So, uh, and it's not always easy either. I learn something new all the time, not just a regulation perhaps, but sometimes just a new waste stream that's out there, a new problem that's out there, a new question. So it's never a dull moment. It changes a lot, but it's definitely been fun and interesting. I'll say that for sure.
I think that's something that most people in this industry can share is that there's always something new. There's
Yeah.
always a new waste stream. There's always a new problem we have to tackle. There's always a
Yes.
new product that we have to take on. Everything's constantly moving, and it's almost refreshing to hear that like, yeah, we all have this that we see, and then we're doing it. So that keeps my job interesting because every day I talk to people, even the same people, they're like, yeah, we have this new thing now. I'm like, oh, tell me about black goo. Let's figure it out.
Yeah.
All right. So healthcare, it's been moving from hospital-centered care to more home-based care. How does that shift kind of transform medical waste management you've seen?
So it's brought medical waste to more places, right?
Mhm.
So, which then brings more questions for me. So, for example, when people, in my inner circle, family and friends and whatnot, right, when they find out where I work, or even new people, you're sitting on a plane and having that conversation, what do you do, right? And when people find out what I do, the next question is almost always, "Oh, I've always wondered what to do with my needles, and I know
Sure.
so and so takes this drug, and I don't, it's a controlled substance. I don't want to throw it away. So what do I do?" And so that's great. And I'm happy to answer those questions, but not everyone has someone like me in their circle of friends, right? Or family.
Mhm.
So, there's stats out there about injections, for example, about 3 billion injections administered outside of healthcare by an estimated 9 million people. So there's a lot of people using sharps, for example, that I don't have 9 million friends, so that would be crazy. But so there's a lot of people out there that kind of, some of them think like maybe there's an issue with throwing this in the trash or putting it in recycling, right? But others may not. And so getting that messaging out to the public is really important on how important waste disposal is, proper disposal, and keeping everyone safe along down the line. So,
Yeah, I think it's easy for people to kind of forget that how much stuff just is waste that
yeah,
is problematic sometimes. Like I'm a person with tattoos. Every time I go to my tattoo
great
artist,
example.
all of that becomes, medical waste.
Yeah,
It's biohazard
yeah,
stuff. It's plastic,
yep,
gloves, everything.
yep,
And it
yeah,
also becomes wet paper towels and stuff too. So like all of that needs to go
yeah,
somewhere and they all need special places to go. So I think
yeah.
that's always a good topic for me to bring up.
For sure. And it's something we've seen. So, or actually, let me back up. So, for me, like, when I first started at Stericycle, I thought, all right, hospitals are our main customer, right? And they
Sure.
are for the most part, but I had no idea. I didn't even think about tattoo parlors generating sharps. And so
Hmm.
now here we are spreading sharps waste and medical waste out into more places. We are seeing sometimes to combat the issue, more kind of, retail type settings, maybe banks and offices installing sharps containers. So instead of it being at the hospital or whatnot, which of course they need to be there, we see other kind of businesses thinking about, oh, how can I help out my employees or the customers that come in? Can I have a disposal option for them? So we are seeing that, and we've got services to help with that, which is great. And then there's another option out there that a lot of people don't know about, something called, we call it Seal and Send, but essentially it's an envelope, and this is all regulated by the DEA, and we meet those regulations, of course, where you can literally put your drugs from your medicine cabinet in this envelope and drop it in your mailbox, and it goes right to our incinerator. Like, it
Mm.
doesn't get any easier than that to get rid of those old, drugs that are sitting in the medicine cabinet. So, there's a lot of cool stuff that we have, but like getting the word out to everybody that this stuff exists is where it is sometimes complicated.
Do you think that that is the biggest challenge you face at Stericycle? Like with all the new compliance and safety challenges, like what is the biggest challenge you guys are suffering from?
I would say for us, I mean that's part of it, but some of that isn't regulated yet, right?
Okay.
So, EPA actually doesn't even regulate medical waste. It's all left to the states. And so we have, state by state requirements to look at for medical waste, some of which have addressed healthcare generated waste, or excuse me, home healthcare generated waste or household waste, many of which have not, though. So, but even, just going back to what we do generally for our hospital customers and healthcare customers, like dealing with that kind of patchwork quilt of regulations is not easy for them or for us, right? Because, there's national customers that probably have locations, do have locations in multiple states, and as do we. And so we've got to constantly be thinking about, like, okay, so we picked up in Ohio, the waste might go to Illinois. What, when we stop in Indiana, what happens, right? So, there's a lot, there's just a lot to think about. The other part of all this, though, kind of back to the kind of household setting, is, it's important that we really start looking at this, I think, because when people, again, don't know what to do or don't have an option, they're just going to throw it away, right? And,
Hmm.
or maybe put it in recycling with the hopes, with wish cycling, right? The hopes that it'll get
Somebody will figure it
recycled.
out.
Maybe, yeah. But I mean, that's a risk to those solid waste workers, right? The drivers that are coming to your curbside, or the landfill workers, because that material hasn't been treated and it's
Mhm.
not even properly contained. So that's another thing to kind of think about. And then with pharmaceuticals, one last point is that those can end up, people might just flush them down the toilet. That was the guidance for a long time from FDA and from others, right? Oh, just flush it. That makes it go away. Not a great idea. So, kind of some environmental concern there.
Yeah, I think, and that covers a lot of like what I see anyway. Is, well, first of all, when I have conversations about people like with what I do, it's like, oh, well, can I
Yeah,
recycle this? Like, well, where are you? Like, it
yeah,
it really depends,
exactly.
because the state by state regulation variation is so drastic sometimes. Like, I don't know how to answer that for you without just you having to call somebody. uh, and
Yeah,
the other side of that is, now I'm seeing all these states kind of pass bills and kind of propose bills. They're like, oh, we don't want another state's hazardous waste, keep it out. So now we're talking about, we can't even transport stuff through a place. We can't,
yeah.
where we were taking it is now shut off to us. Is that just becoming a wider problem too? Like, how do we figure that out?
Oh gosh. I mean,
Is there
that's
a way?
something I think there is. I think that our industry needs to do a better job kind of advocating for ourselves,
Yeah,
right? And promoting the good that we do, right? So, I mean, I'll tell you a story. When I was back when I started at that hazardous waste company, I used to take ballet class for fun in the
sure,
evenings just to kind of de-stress. And I was
sure.
running late, and I come in, I get at the bar, and the girl next to me is like, "Oh, work, huh?" I was like, "Yeah," she's like, "What do you do?" I was like, "Oh, I work at a hazardous waste disposal facility." Ugh, hazardous waste. I'm against that. And I was like, okay, well, sorry, but it exists. It's
Hmm.
here. Like, we aren't the ones creating this stuff.
Yeah,
It's there because of the way we live our lives, right? And that's not to fault anyone, right? But it's just, you can't help but have it around you or have it generated because of a product you bought or
yeah.
something that you no longer use even potentially. But and then she just kind of dismissed me like, oh, you guys just dump it somewhere. I was like, no, no,
I
no, we
like
haven't. So
I like to think
anyway,
this person hears you work at a hazardous waste facility, and she's like, "Oh, you guys must just make hazardous
yeah,
waste
yeah,
and throw it
no,
away." Like, yeah,
of course.
we just make
The
terrible
back
things and put it in
40
the
all
environment.
day. That's where it goes. Like, I mean,
Like, what?
no, 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 no. You have no idea how hard people in this industry work to do the right thing and ensure
Mhm.
this stuff is properly disposed. Are mistakes made sometimes? Of course they are, right? Like, no one is, there's a human element to all of this, but it's not like the catastrophic things of back in the day before there were these companies or these rules, right?
Right.
Rivers aren't catching on fire anymore, thank God, or
Thank God.
and whatnot. So anyway, all that to say, I think the industry, and we talk about this at some of our association meetings, like we need to advocate for ourselves, and we also need the regulators to advocate for us too.
Hmm.
So I know companies that were involved in the train derailment, right, in East Palestine, and there may have been, not the, best of communication from regulators on, hey, like it's okay that where this waste is going. And oh, by the way, it's just dirt, with a
Yeah.
little bit of the chemical in it. So, again, not to fault our partners in in EPA or anything like that, but I think we can all work together to kind of get the message out that these are needed facilities. For us, that happened during COVID. We
Hmm.
really were put in the limelight during COVID. Oh my gosh, we definitely need medical waste disposal, and we are what was the term? Not emergency worker, but we had letters in all of our trucks saying that we were, allowed to be out on the road, and
Hmm.
there's a term for it. It'll probably come.
Yeah, well, I'm trying to think what they were calling, like not man, there is a term. I know what you're
Yeah.
talking. Anyway, it'll come to me. I'm trying
Yeah,
to think
yeah.
of it.
We'll throw it in some point,
Yeah.
right? But yeah, but and that to me, I was like, yeah, you finally get it. Like, we are important. You need the garbage to be collected, be it regulated medical waste, hazardous waste, or your home trash. You need this stuff to be collected. So,
Was it essential worker?
yes, yes,
Okay,
thank you.
boom,
Good
got it, nailed
job.
it.
Good
Okay,
job. See, look at you go.
that's my gold star of the day. Is like it came
Fantastic.
back to me. Cool. Yeah, and I think the messaging is a big important part because, like you said, like the person who you have ballet class with doesn't understand what hazardous waste is. The people who
Right.
are hearing that hazardous waste is coming from the Palestine wreck to their local landfill, like, oh, I don't want that here. I'm like,
Right.
you already have so much of it here. This is already a place that accepts hazardous waste. It's just in the
Yeah.
news now. So I
Yeah.
think the messaging is a big point because no one knows what hazardous waste is, and it almost at
Yeah. They
that
just
point,
think they know they don't like it. And it's
yeah,
like,
they must think it's like green slime that just makes everything
yeah.
radioactive.
Yeah.
Not the case. You would just be against
Same.
hospitals if you're like, oh, I don't like hazardous waste. Well, you don't like hospitals then. Okay.
Yeah. Yeah.
That's who you are.
Yep. I mean, same with medical waste. I think, and people are scared of what they don't know, right?
Yeah.
Stericycle, as you may know, I don't know, but we manage waste from Ebola patients back
Mhm.
in 2014. And I was at Stericycle, of course, but not directly involved. But I know that some of my peers were, on the phone in the middle of the night with governors and regulators who were like, oh, your truck can't come through our state because there's this public perception that Ebola is just spewing out the back of the truck. But no, that's not even possible because the waste is in like 4 bags and a drum and another, like the
Yeah.
packaging requirements for all of this are so stringent. But because it was already ongoing and in the media, it was too late to address that concern and that scare. I mean, I understand
Yeah.
when people are scared. I was scared, but
Once that kind of like optics fear mongering has made it out, like I don't understand
yeah.
what this is. I'm afraid of it. Like, but this has been happening forever, dude. Like you don't
Mhm.
understand.
Yeah.
Okay, so
Yeah.
let's a little bit more regulatory. I guess we'll get back to that.
Sure.
Over the last year, has there been like any significant regulatory changes in medical waste that's kind of notable that is like maybe we should be privy to?
So when I talk about medical waste, I mean a lot of people think about the stuff that goes in a red bag or sharps, but it can
Sure.
also encompass pharmaceutical waste too, right?
Hmm.
Because that's something generated in like a healthcare medical setting. So I would say that the biggest change was a rule that was final and effective in 2019 from EPA, called the Hazardous Waste Pharmaceutical Rule, Subpart P, we call it for short, where EPA did a wonderful job in taking a regulation, the hazardous waste regulations that already exist, and distilling them down for healthcare and making it a little bit easier for healthcare workers to manage. Because there are things when I was this healthcare compliance specialist, my first job at Stericycle, what that entailed was training nursing staff on what bucket to put their pharmaceutical waste in. And unfortunately, there were too many buckets for a while there because of these rules. I mean, in particular, we used to have to tell nursing staff, hey, that empty Coumadin wrapper, that's actually P listed hazardous waste, and that has to go here. Otherwise, you generate too much and become a large quantity generator. So more than you needed to know, but it was really hard to try to, like, I felt guilty grabbing that nurse's attention
Hmm.
when the buzzers are going off and they've got like 10 patients to go visit with and attend to. So the healthcare setting is just such a unique setting. So that EPA rule was really a big deal at the time, and it was a long time in the works. Um, for like kind of true medical waste, not true, but the bloody gross stuff that goes in
Sure,
the red
sure.
bag and the sharps. We typically, because there's no federal regulation, of course, it's at the state level, and it ebbs and flows. So we've had a few changes from states. Michigan made a little change to their sharp storage rules. Ohio recently kind of reorganized and made the rules much easier to read and understand, especially for the generators and the regulated community. Alabama just did some things. Yeah, but the other thing we're seeing though is a little bit more on the enforcement side, particularly in California. You may have seen some of the big headlines. Kaiser unfortunately had a big settlement, and some of the other hospital systems. they're really looking at all their trash, not just medical waste, like everything. And so there's definitely a good chance that could spread. So
So a lot going on
there's a lot
then.
going
Which,
on.
back to the point we made earlier, things are changing
Yeah,
constantly, and
yeah,
sometimes the EPA puts something out in 2019, and then that year an epidemic takes over, and
yes,
it becomes a
yes,
nightmare for everybody. So,
yeah,
I
yeah,
always evolving, always changing.
yeah.
All right, environmental policy, sustainability goals. Where is the intersect of medical waste management in that? What are your thoughts?
So they definitely there's an intersection when it comes to compliance, right? So
Okay.
you can't, even think about being sustainable and having sustainability programs if you aren't first compliant and following those regulations. But I feel a lot of our customers, they know what they're doing. They know what goes in the red bag and the sharps and the pharma containers. So now they are thinking more about, okay, how do I have less waste? How do I become more sustainable in other ways? So, and we also see that with I don't know if you're familiar, there's this group, an organization, I should say, called the Joint Commission. They're an accreditation agency, and there's a few others like them. Joint Commission just happens to be more common. And I think it was about 2 years ago, they put together a certificate, a sustainability certificate program. And so healthcare was like, oh, right. Like healthcare fears Joint Commission kind of more than anyone. Like you say you're EPA, they're like, okay. But if you walk in and they think you're Joint Commission, they're running,
Oh, what? Yeah.
and scrambling to serve you. But um, so with Joint Commission kind of putting their toe in the water of sustainability has really gotten the conversation ramped up in healthcare, I would say. And then there's another organization called Practice Green Health that's been around for a long time. Great organization that does a lot of studies on waste, and so they actually have data out there about 5 point what is the data here? I've got stats. Yeah, more than 5.9 million tons of medical waste are generated each year in the US, and hospitals alone estimate to generate more than 29 pounds of waste per bed per day. So that's a lot per patient. So it's good that these organizations exist and are thinking about it. And so we're all kind of working together to figure out how we can help these hospital systems, especially
Hmm.
that's usually who's kind of at the forefront, the larger systems. How can we help them better manage their waste and do things differently? And for us, we've been able to kind of offer kind of a single vendor service, but we're constantly thinking about other ways to innovate and be helpful, so they can achieve those sustainability goals too.
Well, great, because that kind of segues into my next little question here. We're talking about compliance, and this might be a little two-parter. Piece of advice you would give to healthcare providers who are struggling with compliance. What would you say to them?
I would say you've got to get started at the C-suite level.
Okay.
And because I have found that it seems that that level doesn't always understand the importance of waste management. I'll give you an
Hmm.
example. So, back in my lab pack days, went to a lot of colleges, for example, cleaning out labs and crazy things, but they always had people that knew and understood that waste management was important. They had to hire a company like ours to do what we did, and they'd even sometimes get things started for us before we got there, right? But that doesn't exist much in healthcare. They don't have people dedicated to waste management. It's environmental services, but oh wait, they're also in charge of the cafeteria and patient
Mm, okay.
transport and like 10 other things depending on the day. So we don't see a lot of that kind of dedicated resource, and that has to come from the C-suite, right? Like the
Yeah.
C-suite level folks have to understand that. And I was at a meeting actually earlier this year where we had someone from the C-suite come to our association meeting. And at first he was a little angry at us, I think, like, you guys haven't done enough for us to tell us, what to do and how to collect this stuff. And he was from California. And we were talking about, again, the ongoing kind of situation there with them really kind of pushing proper waste management and segregation. And everyone in the room was kind of like, wait, 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 time out. Like, we have 8 million trainings on our websites and posters, and we have physically come to your facilities and walked to the hospital, day shift, night shift, and talked to anyone who would listen. Were you there, right? Like, did you know that? Clearly you did not, right? So that's where I think it needs to start at the C-suite. And we had that kind of really good conversation with this gentleman to and we asked him, like, how do we get that message out there too, right? Like, how do
Hmm.
we get healthcare to understand, like, yes, of course, job number one, take care of that patient, make them feel better, get them out of the hospital, right? But number two, well, not number two, but somewhere after that, you've got to think about waste management. You can't just throw stuff wherever, hope the red bag is the catch-all, that kind of thing.
Mm-hmm. My message is usually spend the money,
Yes,
realize the importance.
unfortunately, yeah,
It
this
will
isn't
take some money,
free.
but honestly, it's worth it in the long run.
Yes, yes.
And then I guess my second part to that is more Stericycle focused. In terms of innovation or regulatory leadership, what is Stericycle doing in this space?
So, well, one thing I don't think this hasn't really come up yet on this conversation, and you may have heard we got bought by a little company called WM.
Yep,
So,
yep. I
um,
remember.
yeah, yeah. So, that's been really exciting as we kind of work together and figure out how together we can help our healthcare customers. I mean,
Mm,
Stericycle is already, a well-known name and company in the healthcare waste space, but WM has a lot of resources and ideas and products they already have that we can maybe integrate with ours. And so we're figuring all that out, and that's super exciting. And then from a regulatory kind of leadership perspective, we are just trying to see how, we're constantly thinking about how the rules can be better, not just for us, but for our customers too, right? And that's a big part of what I do. When these rules open up in a state, for example, I'm going through it to look at, okay, well, how will this impact our plant there? But also, how does it impact our customer? And I think
mm,
that is really important because they're not looking at this stuff. A lot of the times, hospitals are not even commenting on some of these rules. I'm like, you got to have, but that goes back to what we talked about earlier, just not having someone dedicated to do that type of work in the first place. So,
yeah. Well, we have reached the end of my questions here. I'm going to open up the floor to you. If you have anything we haven't talked about or gone over, this is the moment. What have you got for me?
gosh, what have I got for you?
Anything exciting going on? Maybe I didn't know about coming into the show.
Hmm. Not that I can think of. Yeah. I don't know. Do you have more questions for me or the stuff we get into or
Not off the top of my head. I did all the prep, and now I'm like, all
yeah.
right, we're good. But if that's it, I
Oh,
think that might be
I
it.
did
Go
think
ahead.
of one thing that also kind of cross-pollinates and is a hot topic in the waste world. Lithium batteries, right?
Okay,
So
perfect. Yes, this is
yeah.
great.
Yeah. So lithium batteries, I think you may have seen, I know NWRA just, partnered with Woodsy Owl,
Hmm.
right? And I
Hmm.
just saw the other day that website's active and all that, which is great. That
Sorry,
is
I have
something
a
that,
cat walking
oh,
around
no worries.
everywhere.
I had to
It's
lock my dogs up. So
okay. Anyway, go ahead.
no worries. So lithium batteries are definitely an issue for us in the healthcare space too, because there's all kinds of equipment and devices and things that have them. And we do sometimes see, safety data sheets, instruction sheets from manufacturers even that have wrong information on disposal of those batteries. It's like,
Hmm.
oh, well, wipe it down and then put it in the medical waste. And I was like, first of all, why would you wipe it down in the first place? Like, but
Just take all the
no,
chemicals out. Just wipe it down.
yeah, yeah, yeah. It's clear. That would be great. So, we've seen it's definitely an issue for us, and we worry because there's a lot more things being created that have lithium batteries that we
Hmm.
never would have even thought of before. I know there's a drug that I think it's called Neulasta that they give to chemo patients,
Okay.
and they take it home, and it's an injectable patch, and so it's got a drug, it's got a needle, and it's got a battery. It's like, oh, you've got the trifecta
Checking all the boxes.
of all kinds of things that we need to worry about there. So, but the battery is the problem for the most part.
Hmm.
So we're trying to get in front of that again through the associations and those that make these devices, make it so that the battery can be removed, which isn't always what they want to do either because they don't want the patient to mess with that battery
Yeah.
and mess up the device or how it's administering that drug. So, um, lots of unique things there and something we're definitely keeping an eye on.
That, and we just had another podcast come out that was kind of focused on the state of fires and the industry and lithium and the role that batteries play in that and the messaging
Yeah.
that like comes with things that contain batteries like a disposable vape. People are just
Yeah.
like, oh, clearly it's disposable. I can just throw it away. Like, no, you
Right,
can't
right.
quite just throw it away. So much like this, we see a thing that's like single use. I'm like, all right, time to trash it. That clearly
Yeah,
that's where it goes next.
yeah,
There's just more steps to it than that, and that kind of makes a lot of problems on the back end.
Yep.
it becomes this whole conundrum. And like, there's no easy answer, but we got to figure something out.
Or you get the cop-out answer, dispose of in accordance with state, federal, and local regulations, right?
There you go. Yeah. Like,
um, and it is what it is. I mean, I don't expect these companies that make these devices to be experts in waste management, but they need to be thinking about end of life.
yeah.
And that stands true for a lot of things in waste, right? End of life is that focus, and where will it go? Is it easy to get rid of? Is it not? And so these manufacturers need to think about that too.
Yeah, and then manufacturers need to think about it. But there's also this proactive approach that like users need to have, generators. Like, okay, let's figure it out. There's got to be more to it than this. Well, yeah, that's going to be a hot topic for, and no pun intended, for a long time with the lithium-ion batteries. Well, cool. Was that anything else going on?
Not that I can think of.
Cool.
Yeah.
All right. Well, Cara, thank you for joining me. That's it for us. I appreciate you being here. And where can people find more about you and what Stericycle is doing?
I am really bad about keeping up on LinkedIn. I don't know.
Sure.
Who knows? You may have reached out to me and I'm like, oh, but you can definitely try that. We actually, my team and I have an email address that we, accept customer regulation questions to. I probably shouldn't give that out because all kinds of people read it, so never mind
Sure,
that. But yeah, I mean, I'm happy to be a point of contact, though. I think you have my email and phone number. Happy to discuss. I would also, though, a good way to get a hold of just those in this industry generally is through the Healthcare Waste Institute, which is part of the National Waste and Recycling Association. We're very active there, and that's a great way to kind of get a hold of us if you don't want to like contact a company directly, right? You want to kind of talk broadly about a topic or an issue you have. There's multiple members that could help.
Excellent. Well, Cara, thank you for your time, and we'll talk soon, okay?
No problem. Thank you. Nice to meet you today.
I want to thank Cara again quickly for shedding light on the evolving world of medical waste management and compliance. It's clear that regulations, sustainability, and patient safety all intersect in powerful ways. And leaders like Cara are leading the industry forward, and we should applaud that. As always, don't forget to subscribe to the Waste World Podcast wherever you listen, on Spotify, Apple Podcasts, or your podcasting service of choice. Leave us a rating, a review, and help others discover the show. That helps us bring on cool guests like Cara and the many other guests we've had in the recent weeks to talk about the industry and what's going on in it. Again, thanks for listening, and remember, it's our world. Let's not waste it.